Everyone knows Justin Bieber. He recently suffered from this facial drooping syndrome that caused a stir among his fans worldwide, partly suffering from a Ramsey Hunt syndrome. So I have patients since then on have been asking me if they're at risk and if this can spread like COVID and what needs to be done to avoid such risk. So the question is, what is Ramsey Hunt disease? Is it contagious? Can it be treated? Let's watch this. So Ramsey Hunt syndrome is caused by the same virus that actually causes chickenpox. We all know chickenpox when our children suffers from those blisters during their childhood. The problem is one may have that chickenpox as a child, but after the chickenpox clears up, the virus can still live in your body and specifically hide in your nerves. So years later, once your immune system drops for whatever reason, stress, or any illness, this may result in reactivation of the disease. And when it does, it can affect your facial nerves, resulting in facial paralysis, which is what Justin Bieber is now experiencing. Now, other symptoms that a person may have once this reactivation occurs includes ear pain, hearing loss, some ringing in the ear, and of course, facial paralysis resulting in difficulty in closing one eye, and a sensation of spinning or vertigo, and a change in perception of taste and dry mouth and eyes. Now, it is very critical once this diagnosis is done that prompt and early diagnosis is made because prompt treatment of Ramsey Hunt syndrome can reduce the risk of complications, which can include permanent facial muscle weakness and deafness. Treatment has been shown to be effective, should be done within 3 days of the start of the signs and symptoms if you want to prevent long-term complications. Now, the question of whether it's contagious, Ramsey Hunt is not. Okay, that's the good news. However, reactivation of the varicella zoster virus, which is the virus that causes this problem, can cause chickenpox, specifically in people who haven't had chickenpox or have been vaccinated for it. The infection can also be serious for people who have immune system problems. So to avoid getting infected among people with chickenpox until the rash, blisters, scab, avoid physical contact with anyone who's never had chickenpox or has never had the chickenpox vaccine, including people with weak immune system. The good news is, for most people, the hearing loss and the facial paralysis associated with Ramsey Hunt syndrome is temporary, which we hope for Justin Bieber. However, it can also become permanent. Now, the facial weakness caused by Ramsey Hunt syndrome may make it difficult for you to close your eyelid, and as a result, the cornea, which protects your eye, can become damaged, resulting in eye pain and blurred vision. Now, to prevent this disease from occurring, children are now routinely vaccinated against chickenpox, which greatly reduces the chances of becoming infected with the chickenpox virus. Likewise, the CDC, or the Centers for Disease Control in the United States, now do recommend a shingles vaccine for people over the age of 50 or older, which unfortunately I know is not readily available in our country. Now, prompt treatment of Ramsey Hunt syndrome can ease pain and decrease the risk of long-term complications. It includes antiviral drugs. Steroids can also be given to reduce inflammation, anti-anxiety medications because people may think it's a stroke, and of course, pain relievers because the rush can actually be painful. And therefore, these are supportive measures that can be given to our patients. Now, for the facial weakness, where it makes it difficult for you to close your eyes, it is advisable for one to use moisturizing eye drops throughout the day. And at night, apply ointment to the eye and tape your eyelid shut or wear an eye patch. In short, therefore, the good news is it is not contagious. However, what happened to Justin Bieber is that the course of the disease may be unpredictable because we don't know who will have complete resolution of symptoms, especially the paralysis, and who will get the permanent disability. It is therefore best for all of us who wants to avoid this reactivation of the virus is to continue to boost your immune system with the right food, the right amount of exercise, and of course, good sleep. Take care, everyone. This is Dr. Jerry Tan. See you again soon.